burden of the disease increasing day by day due to air pollution and also environmental and industrial pollution. So we must be cautious about the new symptoms of various diseases and new disease in this country.
Thank you. Sir, how do you manage acute exacerbations of pulmonary conditions, and what preventive strategies do you recommend to your patients?
Okay, acute exacerbation is really challenge for pulmonologists to tackle, and especially bronchial asthma, COPD, and also bronchiectasis, DPLD. There is also acute exacerbation. First of all, we need good emergency service and also uh, trained physician and medical staffs in the outpatient department and also good indoor services. But unfortunately, emergency service is not available all over the country. If you see, there are nice outpatient department emergency in big cities and prominent hospitals, but in the periphery there is lackings of the resource and manpower. And getting management of acute exacerbation, we just follow the protocol, few principles like airway, breathing, circulation, and also uh, supply of oxygen, good nebulization, and providence of steroid and antibiotics. These are the principles, and also we must have all the facilities to do the necessary investigations, labs like radiology, arterial blood gas analysis, D-dimer, electrolytes, etc. It must be there. Without the investigating facilities, we cannot manage the patients with only medications. So you must have the support system, we must have the facility for doing necessary investigation, and we must have the protocol to tackle, and this protocol should be there in every hospital and every uh, outdoor or indoor and emergency service department, and those patients should be given prioritize and quick oxygen, nebulization, steroid, antibiotic. And then subsequently we will manage the case. If needed, this patient should be referred to the ICU department for intubation, or if needed, they should be prescribed non-invasive ventilator, but with good examination, investigation of the patient, and proper judgment of the patients, this decision should be made. And we do have good quality doctors and medical staffs, but I think it will be very pertinent when we can provide those support system in every corner of the country, not in selected hospital and selected cities. And yes.
Thank you, sir. What is your opinion on the use of biologics in treating conditions like severe asthma or COPD?
Yes, biologics are gaining popularity in the pulmonologies and worldwide, but in our country, drawback of biologics is the price, because most of the patients of our country cannot afford these drugs, and those who can afford, they prefer to go for overseas treatment, right? But future of the medical practice lies in advanced medication like biologics or genetical interventions. So biologics, especially those asthma or COPD, which are not controlled by the conventional treatment, and after filling all those steps, biologics is the ultimate answer, and we must find out the selected patients who can afford the price, and we should give them the information and chance to take those biologics. I think this is the latest treatment, but it has the hope to alleviate the problem of our chronic patients. So biologics are the ray of hope for uncontrolled and chronically ill patients.
So children and in the elderly population are mostly vulnerable to pneumonia, especially in winter. Could you please elaborate management of the disease? What can be done to prevent it?
Okay, yes, pneumonia is a problem. It is said that pneumonia is old man's friend, and the ultimate mode of death, not only in elderly population but also other population like immunocompromised, cancer patients, or chronic neurological patients is pneumonia. So pneumonia should be tackled with great care and caution. And also in children, especially under 5 children, lots of children die out of pneumonia every year. So we should be cautious, and the preparation to tackle pneumonia should be started